And when we're on the eardrum again, now the eardrum is about 0.1, maybe 0.2 millimeters in thickness. So it's wafer thin. And if I penetrate this suction probe in too hard up against the eardrum, it can easily perforate it, and it can be very uncomfortable for the patient. Now, when the patient arrived, they said that the second time they had their ears cleaned was probably, it was so uncomfortable, and they were really sure that the specialist was poking and prodding against the eardrum. I suspect not. I think if that was the case, it's very likely it would have perforated it to the degree how painful the patient was describing it. And I think it was more the kind of jabbing and poking against the canal wall, which is actually more uncomfortable, believe it or not. That's how sensitive the bony part of the ear canal is. It's almost like when you've got a toothache, you've got some exposed nerve, and that shooting pain. And I've had it before, and you can't have anything cold to drink, like cold water or ice cream, because it just exacerbates the pain. It's a similar sensation. I've had people in my ear before who have clipped because the front part of my ear canal, on the bony section, it does protrude out, not massively, but it does protrude out slightly. And when a specialist was trying to insert the instrument into the ear, they clipped that, and it was so painful. And when I've had ear impressions taken before, so when you take a cast of your ear, we put the specialist puts an otoblock in, which is like a foam sponge, and you've got a string attached, and that's so you can then later remove it from the ear. I think this is during my training years, and my colleague, fellow student at the time, put a slightly larger than what was required otoblock, so there's a lot of compression. Well, again, it's foam, but it's still, because they have to push it in because it's too large, it's squashed and it's applying pressure against the bony part of the ear canal, and I can still remember that discomfort now. So I've just put some drops in just to loosen this last layer of skin, and we're on the back part of the ear canal, and the drops just help a bit. I was trying to avoid the drops because they've got some otitis externa. I just wanted to keep the ear dry as possible. Now, I mentioned right at the beginning of the video, the specialist that they saw advised them to put water in the ear, and it's fine. That shouldn't be advice we as audiologists should be giving our clients. Water's bad for the ear, and again, that's something I religiously talk about in my videos, and I talk about it to my patients when they arrive. Water can lead to an ear infection called swimmer's ear, and it can do that in two ways. If you have water logged in your ear, so this patient, because of the advice, they used to just dip their head into the water when they're bathing and keep the water in there for several minutes. What that does, the water macerates the skin. So the skin that lines the ear canal, you've got some essential moisturizing factors in there. Essentially, these are oily, fatty secretions. The secretions I'm referring to is sebum. We find that on our scalp. It's an oily, viscous, fatty secretion made up of alcohol, squalene, cholesterols, and long chains of saturated and unsaturated fatty acids. And they are secreted by the sebaceous glands, which are connected to the hair follicles of the hairs that are located on the outer third of the ear canal. And you've also got an oily sweat, which is secreted by modified apocrine glands, also known as ceruminous glands. They are the